the history of Blue Cross was always connected with health coverages, but also public health policy in the state. The structure of the company, Blue Cross Blue Shield, providing health insurance, traditional health insurance, and running government programs was always at the core. But beginning in the 1980s, and that's what I was hired to do at Blue Cross, was create subsidiaries. HMO subsidiaries, insurance subsidiaries, life insurance subsidiaries, workers' compensation insurance subsidiaries. And so while people think of Blue Cross as one entity, it was really, I believe at the end, 11 entities. As the Blue Cross plans, which were all traditional insurance originally, were faced with a new competition, they were forced to change. And because Blue Cross, like many other health insurers, was in financial trouble in the 1980s, we were out of money. Blue Cross was out of money. And so the profit from those subsidiaries helped the parent, Blue Cross, get through those difficult financial times and supported it. I was the single CEO by virtue of history, and we were very careful to have overlapping but not identical boards of directors to again make certain that the business was appropriately handled and divided. And that started in the late 1980s, and by the end of the 1990s, the subsidiary, United Wisconsin Services, was on the New York Stock Exchange. So the board then decided the solution to that was to convert Blue Cross and merge it with the already publicly traded company, United Wisconsin Services. And that was the conversion process that began in 1999 to do that and to give away the entire net worth of Blue Cross. And that was, the result was the conversion and the gift to the 2 medical schools in Wisconsin. And then I retired. So I was pleased by how it worked out.
It was a unique approach to a Blue Cross Blue Shield becoming a public entity. And so the money was given half to the school, MCW, and half to the medical school in Madison. This was a unique approach. Other states had done things like created a state health foundation, or it was given in a different way, to be used a different way.
A main focus of the creation of these endowments is really ensuring that the funds will be held in public trust for the long term, really to benefit the citizens of Wisconsin and to support public health initiatives that benefit the entire state.
So in 2001, I became Senior Associate Dean for Public and Community Health, and I had worked with Mike Dunn, who was, Dr. Dunn was the Dean of Medicine. And so he invited me to work on this new initiative, and we weren't really sure what it would be. But to me, it seemed like a wonderful opportunity to advance our relationship with the community and really to improve health in a number of different ways. So I thought that it was amazing. I mean, if you know anything about the history of endowments, the conversions, there were more than 300 or so that occurred in that period of time, but ours was the only one that went to the 2 medical schools. So that was very unique, and it really was transformative for the medical schools.
The endowment received from Blue Cross Blue Shield is special and unique to the state of Wisconsin. I know other states have similarly been gifted dollars, but in Wisconsin, particularly thinking about how the partnership between the 2 medical schools, I think that's important. I reflect back on my work with the Leadership Institute that was funded early on, and the opportunity to bring together leaders from both institutions, but also we sat around at the table and really talked about what do we need to improve the workforce, the public health workforce in Wisconsin. Out of that work, the Masters in Public Health programs were born. I've consistently come across colleagues or individuals I worked with through that work across the state who say how valuable it was. So I think we really brought to life what is public health, what is the public health workforce, and it's had a significant impact on how we do our work.
The Blue Cross Blue Shield Endowment, MCW, has been absolutely transformative. It's catalyzed so many innovations at MCW and allowed us to invest in partnerships throughout the state that we otherwise would not have been able to accomplish.
As part of the conversion, there were certain stipulations put in place with regard to how those funds from the conversion would be distributed and ultimately used by the endowments. And there are certain requirements that the endowments have to meet in terms of having community oversight committees made up of a variety of different community members.
So I think that at every decision-making table, especially when there are resources that are being stewarded, it's important to have diverse perspective. That perspective could be age diversity, lived experience diversity, but probably for me, I think it's really important that the community itself, it's represented in a way that ensures that the community's needs and desires are reflected through the individuals that are serving.
Advancing a Healthier Wisconsin Foundation has two arms. One of them invests primarily in research and education, but we also have another side that invests in the community in a really important way. And I think it's important to have those two arms, because without those two arms, it might get confusing about where we invest the money or how we include the community or how the faculty see the endowment as it's set up.
It's critically important that AHW fund both medical research and community health initiatives because the two are synergistic. We need to define how care is delivered. We need to define the science of the 21st century, but we need to invest in our public health and our community partners to make sure that everyone in the state has the capacity to live in a community that lifts up health and the capacity to access the care that they need.
I was very excited to learn that this model around community and academia was happening.
I think AHW plays many roles in building and supporting community development throughout Wisconsin. And I think the most exciting for me is the intersection between clinical research and community development. And that really is about putting forward the best ideas and then funding them, using promising ideas out in the field and making sure that this money, which belongs to the people of Wisconsin, is out there doing the work.
It's not just a grant. It really is a unique and innovative philanthropic partnership that, boy, I can tell you, most groups I talk to around the country, when I tell them about this type of thing, they wish their funders did this.
Community and academic partnerships are critical to addressing persistent problems and challenges like cancer disparities because they can't be solved alone. Communities certainly can implement programs, but we won't know if they're working well if there isn't the research to understand, rigorous research to understand what works, what doesn't work, why does it work, what are the levers. That's at more the program level. But when you think about implementing programs that may impact a person's biology, we absolutely need academic medicine involved, but then you can't do that type of research if you don't engage the community and be able to collaborate to do the data collection and the implementation.
Well, one of the things about communities is that we all live in it, and so it's important to form partnerships between agencies and organizations and the governments and other partners in the area because we all live here. AHW has been a great partner to us because it's allowed us the flexibility to build relationships and maintain those relationships in the long term in our own community, within our projects, among partners, across other projects in our area.
Looking back to from the time of the first grant to now, I would say our relationship has gone from being a newbie, a rookie, understanding what health research is and what it's not, to now to the level that we've developed our own capacity, to now we have our own health research department here at UCC, and that's what I manage. We are now in the position of not just being involved in pilot projects, but we have been involved in several implementation projects, medical college and with other universities. It opened the door for these similar relationships with UW-Madison, UW-Milwaukee, even Marquette, and at one point Carroll University. So it's led to that ability that we can now feel comfortable and treated as equals, you might say, as experts from our community, and be able to share the responsibility of the projects and the results in a more bi-directional manner.
I think part of our work in trying to go out and engage with other communities is to let them know that we are not only focused on our neighbors in Wauwatosa and Milwaukee and our partners in Madison, but really that for us, health equity means the health of people all across Wisconsin, and that includes folks as nearby as Wauwatosa and folks as far away as Ashland. And I think that that's our definition of health equity.
Health equity is an important component of our next 5-year plan. It's important that we respect and honor the traditions, belief systems, and values of everybody living in the state, whether that's our rural communities, our agricultural communities, our urban centers, or our self-governed tribal nations. We are committed to making sure that every person in Wisconsin has the opportunity to maximize their health.
Advancing Healthier Wisconsin funding has helped to expand MCW's reach and our impact throughout the state through community partnerships in nearly every county of the state. And this has allowed us to foster relationships across vast geographies that have endured the test of time and really allowed us to have an impact throughout the entire state.
I think the AHW funds have also really catalyzed our regional campuses in some real ways. And so we have a regional campus in Green Bay and another one in central Wisconsin. And those funds have really helped us to grow those campuses and connect with the people in those regions as well.
I feel privileged being able to have the opportunity to go to a medical school here in my hometown. And I really admire the support I have from my family. And I see myself practicing in a community, hopefully like Wausau, where I can serve a community that served me really well growing up. I also like the small town features that Wausau has to offer.
MCW's used the Advancing Healthier Wisconsin to help to enhance and build a contemporary workforce for healthcare and public health in Wisconsin through partnerships, through investment in new programs, and through catalyzing new ideas. So for example, AHW provided startup funds for our 2 regional campuses, which at the time were incredibly innovative for a medical school, especially a private one, to do. And they've been very successful in helping to address the maldistribution of physician workforce in the Northwoods of Wisconsin, serving predominantly white communities in the rural regions of our state. Also allowed us to begin an innovative 3-year pharmacy school in which the pharmacists come out from behind the counter and can lay hands and a stethoscope on the patient so that they can participate at the top of their licensure fully in delivering health care in communities at need.
I am really excited about AHW's future of serving the people of Wisconsin. We have a great track record, and I'm excited to build on that. I feel like over the years, as we've worked to move from grant maker to change maker, we have grown to be better listeners and better partners, and therefore better funders.
I think we are fortunate here in Wisconsin to have AHW funding. AHW is an incredible resource that brings in all medical research, including cancer, into focus into the community. This is a resource that many other states don't have. And here at the Medical College of Wisconsin, we have phenomenal scientists. And AHW provides the resources necessary to carry out the research that is necessary to improve the health of residents of Wisconsin.
You know, people have asked me, how did you come up with the name AHW? So when we were thinking, we wanted something that was forward-thinking and something that showed that we had made a commitment to health in many different ways. And so we called it Advancing a Healthier Wisconsin. And I think that's been the perfect name for it.